Hi everyone, my name is Lauren. Thank you so much for having me as a participant for Career Day. I think this is such a great idea as many students, much like myself when I was in high school, don't really know what to expect after high school, after college, and this gives you a lot of ideas about different careers that you could possibly go into. So I am a medical speech and language pathologist, which you might have heard of the term speech therapist. It's essentially the same thing. I work in a hospital setting. There are lots of different settings that a speech pathologist can work in. They can work in a school setting. They can work in skilled nursing facilities and hospitals, which is what I do, private practice. Sometimes people work from home or into other people's homes. And there are lots of different types of speech therapy that you can do. Some people work just with little kids, some people work with adults, some people work with special populations, but what I'm going to talk to you guys about is focused mostly on the hospital. So within a hospital setting, I work with patients that have had brain injuries, strokes, sometimes patients with dementia, patients with various other disorders. And the primary thing that I'm working on with them is making sure that they can swallow safely, making recommendations for them and for their families, and educating the nurses and the family and the doctors about what is safe for these patients to eat and drink after something like a stroke happens. Because sometimes injuries can cause weakness to one side of the body, and it can make it unsafe for food and liquids to go down. I work with the care team to help determine, does a patient need a feeding tube? Can they eat regular foods? Can they drink regular water, or do they need it to be modified a little bit? Something that I really love about my job is that I get to help people. A lot of times it's helping them talk for the first time or eat for the first time after they've had something like a stroke happen. And it can be really, really rewarding to see how their families react, the smiles you get, the tears you get. You sometimes are hearing them say their first words again after something really detrimental happens. So I love that part of the job, and I love doing education with the nurses and working with the care team to help each patient in their own situation. How did I get here? So I actually didn't know much about the speech therapy world until Mrs. Nelms actually introduced me to the beginning class for my major in college. So she recommended that I take the Introduction to Communicative Disorders class. I ended up loving it, changed my major, and so I finished my 4-year degree as an undergrad for my bachelor's degree, in communicative disorders. Went on to grad school where I got my master's in communicative disorders. And just so you're aware, you have to have a master's degree to practice as a speech pathologist. Once you're done with your master's program, there's something called a clinical fellowship year, which is about 9 months or so where you're practicing under a supervisor, and you have to get a certain amount of hours in that time. You have to get checked off on certain things in order for you to work independently, and you have to do that no matter what setting you're in. Whether you're in the hospital or in the school, you have to do a clinical fellowship once you're done with your master's degree. Other requirements, you have to take this exam called the Praxis, which is like a comprehensive exam that you have to pass in order to get your license. And you have to get a license in whatever state that you're practicing. So let's see. What else? Experience. So I didn't have a lot of experience going into my undergrad, but as you go through the schooling to become a speech pathologist, you gain a ton of experience, whether it's through your clinicals, your classes. Sometimes you have to observe, you have to work with patients, you work under clinicians, and they help kind of guide you through that. As you go on, you gain more and more experience. Something I would advise if you are looking to go into the field of speech pathology, though, is to maybe think about observing a speech pathologist, whether it's in the school setting or in the hospital setting, or even you could go online and do some research on your own, watch videos, look at the information websites to see what speech therapy is all about. And especially if you're a little bit, like if smells and sounds make you uncomfortable or make you feel not so good, make sure you want to work in a hospital before you work in a hospital, because there's a lot of smells and bodily fluids and things that you come in contact with. And I know it sounds gross, but it's just part of the job. So observing in the hospital and, checking out whether that's something you are okay with and would like to do is a really good idea before you actually try to work in a hospital. And it's totally different. So working in the hospital versus working in a school it's like night and day. But being a speech pathologist, you have all of these options under that umbrella. Let's see. So a piece of advice, that's actually part of my advice. I would say observe if you're interested even a little bit in speech therapy or any part of the rehab careers. Observe, stay focused when you're in school, try to get good grades, because in order to get into grad school, you usually have to get good grades. So not that it's an absolute, but it's a good idea. I actually would like to show you something, because this is what got me interested in speech therapy, is a video swallow study. And now this is, I'm going to try and figure this out. This is something that I wanted to share with you guys, and this is part of how I became interested in the medical side of speech pathology. This is what's called a modified barium swallow study. And I do these almost daily with my patients. Sorry, there's a little bit of a glare, so it's kind of hard to see. But this is an x-ray, essentially, of a patient swallowing. And you can see right here, that black material is food that the patient is trying to clear from their throat. Now, what I would do is watch these videos, assess for weakness, for different areas that are problematic, and try to make a recommendation as far as what can the patient eat safely, what kind of strategies do they have to use to get the food down safely. I just thought this was kind of interesting to show you, because this is what got me interested in the medical side. It's something that you get to do, and it's a little different every day. I hope this was helpful. Thank you for letting me participate in Career Day. I hope you guys have a good rest of the day. Thank you. Bye.